everyone else. So we're going to have a terrific discussion on the profession of nursing and sort of the challenges and contributions of nursing, and particularly those in the profession. So we're pretty much at the point where we can get the show on the road. So let's do that. And please do contribute your questions. Your questions are so much better than mine, and I'm always taking advantage of prompts that people give me. Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim. Today, even though National Nurses Week has just passed in May, we want to keep the gratitude going by thanking all the nurses in our country for the important work that you do. And we are going to cover a variety of issues with our special guests, Jonathan Webb, Chief Executive Officer of the Association of Women's Health, Obstetrics, and NeoNatal Nurses, Kate Judge, Executive Director of the American Nurses Foundation, and Nancy MacRae, CEO of the Emergency Nurses Association. And a reminder to Zoom attendees that we'll take 3 snap poses during the show, and we'll announce results, and your questions submitted at the Q&A function at the bottom of your screen will be included in our discussion. So thank you all for joining us. Jonathan, Kate, Nancy, it's just great to see you.
Thank you for having us.
Yeah, thank you.
Well, I'm so excited, I have to tell you, and I want to have a special call out to my Aunt Janice, who is a nurse, who is just an amazing person and has basically been a mainstay of our family. She is an amazing, amazing contributor to so many people with a heart that is just so big and so instructive to me in my life. I want to just sort of set you up, and we're going to go over to you, Jonathan. I'm going to set you up with this sort of quote. It's really interesting. When you look at career satisfaction, intention to leave jobs, mental health, and well-being issues among registered nurses, they really are fairly significant. And I want to quote the AMN Healthcare survey of registered nurses that was done by, and there's a quote by Chief Clinical Officer Dr. Cole Edmondson. The health of our nation is tied directly to the health of the nursing workforce. So let's talk about that health of the nursing workforce, Jonathan. How do you see it, and how do you see this sort of the state of affairs in the profession today?
Well, thank you for the question and the space for dialogue, and thank you to your aunt for her service in the nursing industry. I think it's a really interesting question and on top of discussion. I'll first and foremost say that I think nurses are probably, in my opinion, one of the most passionate professions in the nation. And because of that, I think they sacrifice a lot on behalf of their patients. I think they're quarterbacks of care. They're connecting the doctors and other providers with their families and communities they engage with. So they're directly related to the provision of care in a meaningful way. And they do this in a very selfless and passionate and sacrificial way. The challenge with that is, I think, that when we have called on them to respond to many crises, but most recently to the COVID pandemic, we have not always equipped them to do their best work as holistically. During that pandemic, the nurses that we work with were called into action in a real way, and asked to put themselves and their families at great risk. And they did that without complaining, without having the appropriate equipment, sometimes the appropriate training to do that. We did not, as a nation, in my opinion, also support them from a mental and emotional health, with all of the things I'm talking about, from a sacrifice and loss and things they're seeing, haven't necessarily equipped them well or had to give them the space to process that. I also don't think, as a nation, we have invested in them in a meaningful way. During that time, I completely understand the need to support and bring travel nurses in to help to support the shortage that we're seeing. But in some ways, it created this weird dichotomy of those individuals who are already within the nursing system, standing alongside their sister and brother nurses with disparate pay grades. So I think there were. Let
me just describe travel. Could you just define the term travelers?
So travelers, we have nurses who are not connected to the hospital, who are brought in from outside of the health system to fill a need, often at 4, 5, 10 times the pay rate than their sister and brother nurses they're working alongside.
So what you're saying is that the system itself is so thin that during this type of an event like COVID, that you end up with people who, first of all, because there are so much on the front line, they're not protected. The staffing is not organized in a way that allows for a systematic response. And so what you end up with is people who are, you have a sort of a chaotic situation that people are kind of on their own to navigate an emotional situation, an endangered, a personal endangerment situation, right, where they're just sort of left to their own devices, right?
That's exactly it. And I think what you end up with is really passionate professionals who end up burnt out. And then you'll start to, they'll continue to do their job because that's what they're called to do. But then you start to see some of this reflected in the data that you're citing about workplace satisfaction, interest in maybe considering other careers, things of that nature. And then when you add on top of that, what we've seen recently, not just recently, but it's gotten more attention recently around the workplace violence that nurses are experiencing with people coming into hospital settings and threatening or putting nurses in situations where their lives are in danger. All these things are factors that contribute, I think, to what the report is seeing.
Kate, could you talk a little bit about some of these topics as well, and what your constituents are feeling, and how that experience, traumatic as it was, has resulted in different attitudes and approaches that are set to address some of the topics that Jonathan highlights?
Yeah, great question and great topics and great comments, Jonathan. I think that what we've seen nationally as we've surveyed nurses really since the beginning of the pandemic is that, as Jonathan said, nurses want to show up, they do show up, but the level of chaos, the level of trauma that was accentuated in the pandemic. I mean, you have to remember, a nurse's job is hard. It was hard long before the pandemic, but it just got that much harder. And we've seen them cope with extraordinary levels of stress, frustration. We consistently see, and we have a new survey coming out, we partnered with McKinsey, that they continue to be stressed. They're less stressed than they were. There is some normalization now, but they're not feeling like they've gotten the support of their employers. They are looking for more flexibility. I think that people traveling is going to be a new reality for the workforce, and we have to embrace that. Nurses are looking for flexibility. Nurses are looking for meaning. They're looking for variety. And, you know, I've been around nurses for 30 years. I'm not a nurse. I'm just so lucky to have been around them for 30 years. And this is a sea change for what people can expect. And I think we've got the public looking at nursing and understanding that the economy rests on healthcare, and healthcare really rests upon the expertise of nurses. They are committed, they are passionate, but they are experts in understanding the kind of care that we need and really being the safety for all of us who are both in acute care and in primary care. So I think that what we're seeing is we're at this inflection point. We have never seen the sense of my well-being is really at risk in my job before. That's what they're reporting consistently. You know, always nurses have struggled with, do we have enough nurses and other colleagues in the care environment to take care of the right patients? But now they're really putting together that level of stress and the sense that I'm compromising my very own life and ability to thrive. And that's not a fair thing for us to ask nurses to do. We don't want tired nurses. We don't want stressed nurses. We want them at the best that they can be, taking care of us and our children and our parents and our grandparents.
And Nancy MacRae, your constituents, the Emergency Nurses Association, your constituents are sort of by definition, you're in the midst of trauma in emergency rooms. But there's a difference, because just being in that environment in the past wasn't necessarily unsafe personally, but during COVID, it was. Just presence, just physical presence becomes a traumatic, worrying issue about what you're going to bring home to your family particularly in the early days of COVID. How did people cope, and how do you see changes that have come to fruition, or that where consciousness has been raised about necessary changes that are required in the future for the work that your emergency nurses do?
Yeah, really appreciate the opportunity to, support the conversation and really think laid out, all the issues really well. And can't underscore enough the statement of, the health of our nation is definitely tied to the health of the nursing workforce. So, like you said, in emergency nursing specifically, they do thrive on chaos. We talk about the chaotic environment. That is at the core of what happens in emergency departments. But they're trained for that. And so, and prepared and supported. And so that really is the fundamental aspect of emergency nursing, is you may not know everything that's going to walk through the door, but you have really good systems and support and training in place that gives you those protocols to follow. And certainly, as we've all said, there were no protocols in the pandemic. And so everything has changed in so many ways. And so certainly, not knowing what they're dealing with, they very much, in emergency nursing specifically, very much on the front line, not supported. In the early days, nobody knew how to support. And so in fairness to that, it wasn't known. Not only risking their own personal safety without even thinking about it, but what we're seeing now is in many ways that downstream effect of it. Not only their personal safety and that passion for them to just keep going, but what they saw, what I hear them describe in terms of what they saw and endured day in, day out, of the volume of patients that were coming, that they had no options or care for them, the family members that had no support for what was going on, the amount of death that they saw was really, really traumatic. And right now we're seeing that very much contributing to a lot of the workforce issues we're seeing specifically in emergency nursing. We're seeing the rate of emergency nursing burnout even higher than the overall nursing workforce that I know, Kate, you shared, your research and continue to look at that. Really important to see. We're seeing that probably, 10 times higher, specifically within the emergency nursing space. And so the need, the opportunity, the imperative really is there for us collectively, as well as certainly our organization, to look at all different ways that we can improve the environment overall, the work environment for emergency nurses, to help create a healthier workforce.
Could you all describe a little bit, for somebody who doesn't know as well, the culture of nursing? Does it allow for self-care and for periodic, organized transitional experiences that will bring down the level of tension and trauma? You see in, for example, law enforcement, a tradition of sort of setting aside personal trauma. You see in firefighters that idea of setting aside. You see that in the military. These are traditionally male-dominated professions where traditional attitudes of masculinity can sort of infect people's behaviors. How does the nursing profession, Jonathan, and then Kate and Nancy, deal with this idea that people who are living within a traumatic environment need some self-care and need a break?
Yeah, I mean, it's a great question. I would say I had the ability to travel to spend some time with a lot of my members, but also in their healthcare systems. And in terms of the structures that exist to allow for the self-care, I think it varies from place to place. There are some institutions that do it really well, carving out time and like quiet rooms and places for people to go to kind of decompress. There's always what I've seen is a great culture of camaraderie at the health institutions and clinics and sites. So there's a lot of that sort of iron sharpening iron, and people being able to lean on each other for support. But the actual structural things that exist to allow them to self-care varies from site to site. So we do a great deal with our members to try to provide them with strategies, resources, education on how they can take some of that time and claim some of that time for themselves to recharge their batteries, because I like to say you can't pour from an empty cup. We try to support them in that. To the point about how different industries handle it, I do think that nurses do a really great job of compartmentalizing as they need to. But I also think they do it without losing humanity, because I think some of the experiences they have encountered help them to be more empathetic and more engaging because of the things that they've seen. It's just that they put themselves way at the back of the line as they are meeting the needs of their patients, which I think can be problematic for them individually, but it's what they've been called to do in the service of others. Just making sure they have time at some point to come back and refresh and recharge so they can be their best selves.
Kate, Nancy, do you see a difference also between the nonprofit nursing sector and then the for-profit settings? I mean, we've seen for-profit organizations take over the management of emergency rooms and that kind of thing. How do you see this issue of self-care?
Well, I'll jump in on self-care. It is a standard that nurses are taught that they need to take care of themselves, put the oxygen mask on first, but it hasn't been, in my experience, embedded in the culture. And the quiet rooms are the first ones to go to get repurposed when you need another room for a patient, right? It's sort of expendable. The American Nurses Association, my colleague organization, we've started something called Healthy Nurse, Healthy Nation before the pandemic 5 years ago. We've done so much more around wellness and well-being, and we partnered actually with ENA right away as the pandemic started. But getting nurses to actually take the time to take care of themselves is a real challenge. I will say that I'm holding on great hope to generational shift. So my kids' generations don't want to sacrifice their health for their job. And so I think that might be a real motivator for the industry to shift, whether it's for-profit or not-for-profit. And for leadership, this is going to be a challenge for nursing leadership to say, especially in an environment where there are not enough nurses. We know that 100,000 nurses have left the profession. We're looking at shortages of various predictive amounts. So we're going to have to figure out, even with less nurses, how to change the environment so that self-care isn't dependent just upon the nurse to do it, but for the environment to create something that is a place where people want to go to work. If we don't have environments where people want to go to work, they won't work there, and then we're all going to pay the price. So we're beginning to really shift from helping individual nurses, as we did in the pandemic, with financial stipends when they were furloughed and they were sick and they weren't getting paid, and mental health programs that we'll continue to offer, to really looking at how do we invest and reimagine the nursing space and the environment. Because we can, there's lots of money that's going into education of nurses. Let's bring more people in. But if it's an untenable situation, they can't stay there. And we all have to fix that. The public, associations, the nursing profession, but really the care models that are delivering these environments right now for nurses. Nancy?
Yeah, no, I would, certainly add on to the, overall the system, right? And Jonathan, like what you said, it varies widely. And so totally see that. And so continuing the imperative to kind of address it overall from, an overall healthy work environment. Like you, Kate, ENA has been focused on healthy work environment for many, many years, and it affects multiple layers, including individuals. So education, resources, training tools for individual nurses to learn how to certainly take care of themselves and each other, but also in the system, such a key piece of it. And obviously the systems continue to change. So Mark, for-profit, profit, in our view, doesn't really matter. It is about the system, no matter how it is funded. It is about taking care of your workforce. And so the system needs to support that in new ways that hasn't been happening. And so continuing to look at solutions in that regard. And then obviously at the public policy space as well, continuing to find ways to support legislative and policy changes that will continue to address system-wide self-care for nurses that ultimately help create a healthier work environment and then workforce, and patient care ultimately, which is what everybody's passionate about.
Well, it's interesting. We've just done two polls. One shows that 3/4 of the people who are attending this live through the Zoom webinar either are nurses themselves or have family members who are nurses. What was interesting is in the second poll, we talked about what do you think is critical in terms of support for nurses today. And we've got a number of different options, but one option that got 100% response is worksite mental and physical health resources. Do you all believe that that's about job one in terms of helping nurses stay in, or are there other areas that you think are more important than that whole idea of self-care? Nancy?
Yeah, it's not an easy answer for me because I don't think
Right.
it's job one. And so I certainly think it's fundamental at the baseline of it all, but just providing those aren't enough if the system and the people don't fully support the people in it taking advantage of those. So it becomes this, double-edged sword, so to speak. We've seen and heard, places where, well, we provide that, so everything should be okay. But if it's on your off hours or it's not supported at the time when maybe you need it most, particularly in the ED, when, certainly trauma, as you're trying to de-escalate from that, it needs to be supported at the system level, not just providing it isn't enough.
So it's attitudinal as well, right? It's basically having it permeate everything that you do, from the planning and budgeting that you do to what happens in the moment on the ground and then in the aftermath. It's the whole shebang, right?
Absolutely.
Yeah,
Okay.
we've seen nurses consistently say that there are EAPs, right, employee assistance programs, but they're not by and large taking advantage of them. Sometimes because they feel that there's retribution. Sometimes, as Nancy said, like, it's during my work time, I can't take time to go to lunch.
Everything.
Yeah. How can I process that? So I think it's not a checkbox. We really have to move beyond the, and we experienced this in the pandemic, working with ENA and critical care nurses, like, we built things, but just building them isn't enough for them to come if they aren't really designed in a way that is going to fit into their extraordinarily busy life. They want short pieces, and we're going to have to figure out how to deliver that. But mostly, that they are not mentally taxed and exhausted is top of the list. But the way to do that isn't just by helping them cope with an impossible situation. We have to actually change the situation they walk into every day. That's what has to be the imperative for policy, for organizations, for consumers, and certainly for employers. We know that the C-suite, it just is constantly talking about, how do we solve this nursing problem? And it's how do we engage nurses to help us reimagine the work environment so that they can come and they can do different things. We were just out, you asked a question about for-profits. We were just out with one of our grantees in our Reimagining Nursing program out in Phoenix. And you have nurses who are doing, they're certainly still working in acute care, but then they're also doing this really innovative home care where they're going in and really having the time and the ability to connect with patients in a way that is not consumed by a pretty fractured environment where they work, and they're thriving. These nurses are so happy. And so we've got.
Are these on the for-profit side or the nonprofit side, or?
This is a for-profit organization that we're supporting, but it's a lesson that all nonprofits can learn from, right? How do we give nurses the ability to operate in their environment, make their environment better, but then maybe have the flexibility to do some other things, to walk into somebody's home and say, let me have the time to really talk to you about what's going on with your care, help you sort through your medication, make sure you're safe, talk to your family. It's amazing when you meet nurses who have the opportunity to do that. They are incredibly resilient and thriving.
And I would just quickly add to that, Mark, that I think it's very difficult to just have it, the response hone in on the programmatic solution of having resources available. I think it's extremely important. But I think, to echo what Kate and Nancy said, I think it needs to be more of a systemic solution, one that's based on valuing your team member, valuing your employee. So creating a system where people feel comfortable to take advantage of those things without retribution. I think having equitable pay that recognizes their contributions in the healthcare environment, setting up, allowing training. That's one of the stats that Kate talked about was 100,000 nurses leaving the workforce. So that means new people being called into roles that they may not have been experienced with doing before, and are now being thrust into that position to do that. What sort of training is being provided to support them in meeting those new responsibilities?
Well, simple respect as well, right? I mean,
Respect.
part of our healthcare system's problem is that we're so hierarchical. It doesn't escape my notice that I walk into a healthcare setting and the doctors are called doctors and the nurses are called by their first names. Right. I mean, that in and of itself ends up having an issue, because if you are sitting around planning how you're going to manage this continuum of care that you're providing, if you have a tilted hierarchy, then that tilt will end up favoring the priorities of the people who are hierarchically above others, right? Whereas the nurses are taking care of me as a person, right? I want that nurse to have a voice. How do we change that kind of a culture? Are people getting together? Are the doctor, nurse, and other staff divisions beginning to break down? And are people talking to each other in healthcare settings in the post-COVID world in a way that they hadn't previously, Kate?
I think they are, and I think they aren't. So certainly we are seeing groups work together. We worked with a number of nursing and non-nursing groups during the pandemic to look at solutions. But there's money at play. There are issues of authority and autonomy at play. Those are complicated issues. I think what we did see in the pandemic is there was so much change that was possible quickly. I think you need to have that urgency again. So I know many physicians and pharmacists who are all about the team and helping it work, but sometimes we see on a national level things still break down between doctors and nurses, and what is quality care. And for my 30 years, I have no question that nurses are delivering extraordinarily high levels of care with outcomes that match in primary care physicians. We kind of need to move on. And in some ways, many parts of the world have moved on and said, this is a great solution, let's have more of that. And that's an opening for something better in the future.
Nancy, what kind of changes do you think are required in this vaunted healthcare system that we have in the United States? What shift will provide better care for patients and a better quality of life and greater retention for your constituents?
I mean, I think, Jonathan, you teed that up really well. I think I would echo and just repeat it. I think that's really important to lay out all of the different issues, but it is around valuing your team, each other and your team. It starts with respect, it ends with respect. Equitable pay is clearly at it. Training, safety, one thing we hadn't touched on, and early on mentioned, you need to work in a safe environment, and it isn't in a lot of places. And that again is another systemic solution that is needed to provide a safe working environment for our nurses. And many of them are in situations where there's a lot of vulnerability, and we need to make sure that we are protecting the people who are serving there. And so a really important piece of the solution is creating a safe workplace for our nurses. It really, again, gets to the system. So it's not an easy answer, but it really, gets to, I do believe that, certainly within emergency nursing, the emergency physicians and the emergency nurses all understand and see the challenges and the issues. It's how we get to the solutions that continues to be the challenges. So we want to keep looking at all avenues for ways to build those solutions.
And Jonathan, let me give you the last word. What kind of change should we be thinking about to improve the whole field for nurses, to make sure that my kids are really considering this as a professional choice, a rational professional choice, either in the emergency room or in some other role? What do we do?
So I would echo all the things that Nancy mentioned earlier, the systemic valuing of our team, and all the things that contribute to that. A couple of things that have not been mentioned yet, though, is I would say one of the things we worked on is providing a standard around what certain staffing levels will look like, because the other things you have is that you have nurses spread really thin. So having part of that value is making sure that there's a standard level of staffing to support their care. And the last thing we haven't talked about is ways that we may intentionally look to diversify our perinatal workforce, because there's opportunities to help to support this nursing workforce shortage by making sure it's diverse and reaching across to different demographic areas. to help to make sure care is continuing to be delivered equitably, but also with support from community members and individuals who represent those who are they're providing care for. So I think that's the way that we actually get to a place where we are valuing and supporting our nurses, by starting with them. And I think this one piece, when we look to redefine and design systems, really needing to engage the end users in the conversation. So as we're starting to adjust and build a system, that can't be done without the voices of nurses at the table to make sure what design truly meets their needs now and in the future.
As in so many other things, just listening to each other and showing respect, true respect, not lip service respect, but true respect, meaning that you change systems because of input that you receive from different members of the team, having different roles, very important roles in the continuum of care, is so important. Jonathan Webb, the Chief Executive Officer of the Association of Women's Health, Obstetrics, and Neonatal Nurses, Kate Judge, Executive Director of the American Nurses Foundation, and Nancy MacRae, Emergency Nurses Association CEO. Thank you so much for sharing the work that you do. Please thank your nurses. Please thank your funders. Please thank your staff, because our health, my health, depends on you. Thank you so much.